Thank you, Madam Chair. I'm honored to join my colleague, Councilor Fitzgerald. I also wanted to recognize Councilor Murphy that's been at many of these demonstrations out in front of the Carney Hospital as well. I agree with everything Councilor Fitzgerald talked about. For me, the Carney Hospital is personal. This hospital started out in South Boston on the corner of Old Harbor Street and Dorchester Street, where the Marion Manor is right now. My grandmother worked there for many, many years. She lived across the street. She worked in the kitchen. That was my mother's mother. I also had the opportunity to work when I was working full-time as a probation officer at the Carney in their security department at night, especially on the weekends. And I have to tell you, the amount of emergency room visits to this site was nonstop. And I would see people coming in for many reasons, sometimes due to alcohol or substance use or violence. And I also saw many of the nurses that are here today. You know, Carney nurses. They would provide the most exceptional, professional, and compassionate care to the patients, even though at times the patients would assault them. But the nurses would get back to work and still provide that same level of exceptional medical care, day in and day out, night in and night out. I also saw the cafeteria people and the x-ray technicians and the other dedicated workers there as well, social services at the Carney Hospital, doing an outstanding job and an exceptional job. Want to recognize Mass Nurses Association, Kate Murphy, but also the wonderful Carney nurses as well. But I think John said it perfectly. We have 30,000 emergency room visits every year to the Carney Hospital. And where are they going to go? Well, most likely to the Boston University Medical Center. Probably 25,000 more visits there. But let you know that that is also overstretched. And the line for emergency room visits is also very long. We're going to add to that. So we are calling for a public health emergency by the mayor, by the governor. But my friends, we're already in a public health emergency. It's not going to get better. But what we can't do is give up on the hospital. We can't throw up our hands and say, it's unlikely that the hospital is going to stay open. And I say that because these nurses over there, they don't give up on their patients. They never have. The people that are cooking the food, they don't give up on the patients. They never have. The workforce wants us to do everything we possibly can to keep this critical medical facility open. And at the end of the day, we have to ask ourselves as city officials, have we done everything in our power to keep it open? Did we give 100% of our time and effort to keep it open? We're not there yet. It's too early to talk about a closure. Now is the time to stand up with the dedicated workforce and fight for them. Because they've been fighting for patients in this city for over 100 years. And I'm not going to give up on them. I don't think my colleagues here are going to give up on them. I know the residents of Boston have never given up on the Carney Hospital. So I'm asking all of us to stand together acknowledge the incredible professional, dedicated, compassionate workers. The Carney family is really what it's all about. I'm asking you to join us in support of this resolution. Thank you.